Hello, everyone, and welcome back to the Neurology channel. Today, we're discussing an incredibly important topic: tips for caregivers and neurological conditions. Caregivers play a crucial role in the lives of those living with neurological conditions. In this video, we'll share valuable tips to help caregivers provide the best possible care, support, and understanding to their loved ones. Educate yourself. First and foremost, knowledge is power. Educate yourself about the specific neurological condition your loved one is dealing with. Learn about its symptoms, progression, and available treatments. Educate yourself is a fundamental principle for caregivers of individuals with neurological conditions. Understanding the condition and its specific challenges is essential for providing effective care and support. Here are key aspects of educating yourself as a caregiver. Learn about the condition. Begin by thoroughly researching and learning about the neurological condition your loved one is facing. This includes understanding its causes, symptoms, progression, and available treatments. Reliable sources of information include reputable medical websites, books, and resources provided by healthcare organizations. Consult healthcare professionals. Schedule appointments with healthcare professionals who specialize in the specific neurological condition. Neurologists, physical therapists, occupational therapists, and other specialists can offer valuable insights, answer questions, and provide guidance on caregiving. Ask questions. Don't hesitate to ask questions during medical appointments. Be prepared with a list of questions and concerns to ensure you have a clear understanding of the condition, treatment options, and what to expect in the future. Attend support groups. Join support groups or organizations dedicated to the specific neurological condition. These groups often provide educational materials, webinars, and opportunities to connect with other caregivers who can share their experiences and insights. Stay informed about research. Stay up to date with the latest research and developments related to the neurological condition. Advances in treatments, therapies, and understanding of the condition may impact caregiving approaches. Understand medications. If medication is part of the treatment plan, educate yourself about the prescribed medications. Learn about dosages, potential side effects, and the importance of adhering to the medication regimen. Recognize the impact on daily life. Gain insight into how the neurological condition affects your loved one's daily life. This includes understanding any limitations, mobility challenges, cognitive changes, and emotional aspects of the condition. Consider legal and financial aspects. In some cases, it may be necessary to educate yourself about legal and financial matters related to caregiving. This can include healthcare directives, insurance, financial planning, and government assistance programs. Safety precautions. If the neurological condition presents safety risks, such as falls or seizures, educate yourself about safety precautions and necessary adaptations to the living environment. Cultural sensitivity. Consider cultural and personal factors that may impact caregiving. Awareness of cultural beliefs, traditions, and individual preferences can help tailor care and support. Empathetic understanding. Beyond medical knowledge, strive to empathetically understand the emotional and psychological aspects of living with a neurological condition. Recognize the challenges, frustrations, and fears that your loved one may experience. Continual learning. Neurological conditions can be complex, and caregiving strategies may need to evolve over time. Stay open to continual learning and adapt your approach as needed to best meet your loved one's changing needs. Educating yourself as a caregiver is an ongoing process that empowers you to provide better care, make informed decisions, and offer emotional support. It also contributes to a higher quality of life for your loved one as they navigate the challenges of their neurological condition. Remember that you're not alone on this journey, and there are resources and professionals available to assist you in your caregiving role. Effective communication. Communication is key. Maintain open and honest communication with your loved one. Encourage them to share their thoughts, feelings, and concerns. Here are key principles of effective communication for caregivers. Open and honest communication. Foster an environment where open and honest communication is encouraged. Create a safe space where your loved one feels comfortable expressing their thoughts and feelings. Active listening. Practice active listening by giving your full attention when your loved one is speaking. Avoid interrupting or rushing them. This demonstrates that you value their input and concerns. Empathy and understanding. Try to understand your loved one's perspective and emotions. Put yourself in their shoes to empathize with their challenges and feelings. Show compassion and support. Use clear and simple language. Neurological conditions can sometimes affect cognitive abilities. Use clear, simple language and avoid jargon or medical terminology unless your loved one is comfortable with it. Ensure they understand what you're saying. Nonverbal communication. Pay attention to nonverbal cues such as facial expressions, body language, and gestures. These cues often convey emotions and thoughts that may not be expressed verbally. Respect personal space and boundaries. Respect your loved one's personal space and boundaries. Some individuals may need physical space or time alone to process their thoughts or feelings. Be patient. Be patient when your loved one is communicating, especially if their condition affects speech or makes it difficult for them to find the right words. Avoid finishing their sentences for them. Ask open-ended questions. Encourage meaningful conversations by asking open-ended questions that cannot be answered with a simple yes or no. This invites your loved one to share more about their thoughts and feelings. Validate feelings and experiences. Acknowledge your loved one's feelings and experiences, even if you don't fully understand them. Statements like, "I can see that you're frustrated," or "I'm here for you," can provide comfort. Maintain a positive tone. Use a positive and supportive tone when communicating. Avoid criticism or negativity, as this can increase stress and anxiety. Choose appropriate times to discuss sensitive topics. Avoid bringing up difficult subjects when your loved one is tired or stressed. Provide reassurance when appropriate. Let your loved one know that you are there to support them and that you'll work together to find solutions to challenges. Clarify information. If your loved one receives medical information or instructions, help clarify and reinforce this information as needed. Ensure they understand their healthcare plan and treatment options. Use visual aids. For individuals with cognitive impairments, visual aids, such as diagrams or written instructions, can be helpful in conveying information or instructions. Seek feedback. Encourage your loved one to share their thoughts and feedback on their care and support. Ask if there are specific ways you can improve your communication or caregiving approach. Consistently practicing these principles can enhance your ability to provide emotional support, reduce misunderstandings, and strengthen your relationship as a caregiver. Create a supportive environment. Creating a supportive and safe environment is essential. Make necessary modifications to the home to ensure accessibility and safety. A nurturing and accommodating setting can enhance their overall well-being, comfort, and quality of life. Here are key elements and strategies for establishing a supportive environment. Safety modifications. Assess the home for potential hazards and make necessary safety modifications. Install handrails, grab bars, and ramps as needed to ensure accessibility and prevent accidents. Adequate lighting. Ensure that all areas of the home are well lit, including hallways, staircases, and bedrooms. Proper lighting helps reduce the risk of falls and enhances visibility. Accessible living spaces. Adapt living spaces to accommodate mobility aids, such as wheelchairs or walkers. Create clear pathways and remove obstacles to make movement easier. Comfortable furniture. Choose comfortable and supportive furniture. Consider adjustable or reclining chairs that provide comfort and assist with positioning. Assistive devices. Provide and maintain assistive devices and mobility aids, such as walkers, canes, or shower chairs. Ensure that they are in good working condition. Clear communication aids. For individuals with speech or communication challenges, use clear communication aids such as picture boards, communication apps, or speech-generating devices. Medication organization. Organize medications in a systematic way. Use pill organizers or a medication management system to ensure that medications are taken as prescribed. Routine and structure. Establish a daily routine and structure to provide a sense of predictability and stability. This can reduce anxiety and confusion for individuals with neurological conditions. Noise reduction. Minimize noise and distractions in the environment, especially for individuals who are sensitive to sensory stimuli. Soft furnishings, curtains, or soundproofing materials can help. Supportive seating and bedding. Invest in supportive seating and bedding that promotes comfort and reduces the risk of pressure sores, especially for individuals with limited mobility. Accessible bathrooms. Adapt bathrooms for safety and accessibility. Nutrition and hydration. Ensure access to a balanced and nutritious diet. Encourage hydration and provide easy-to-access water sources. Emotional support. Create a supportive and emotionally nurturing environment. Respect for privacy. Respect your loved one's privacy and personal space. Allow them to maintain a sense of independence and dignity. Engagement and activities. Encourage engagement in activities and hobbies that bring joy and purpose. Social interaction. Facilitate social interaction and maintain connections with family and friends. Regular healthcare visits. Schedule and attend regular healthcare visits. Ensure that your loved one receives ongoing medical care, including checkups and follow-ups with specialists. Adapt and modify as needed. Continuously assess and adapt the environment based on changes in your loved one's needs and abilities. Your understanding, patience, and empathy play a vital role in fostering a nurturing atmosphere for individuals with neurological conditions. Seek respite care. Caregiving can be physically and emotionally demanding. Don't hesitate to seek respite care or temporary relief when needed. Seeking respite care is a crucial aspect of caregiving, particularly when caring for individuals with neurological conditions. Respite care offers temporary relief and support to caregivers, allowing them to recharge, reduce stress, and prevent burnout. Build a support network by connecting with other caregivers, joining support groups, or seeking guidance from healthcare professionals. Building a support network is essential for caregivers of individuals with neurological conditions. Encourage independence. Empower your loved one to maintain as much independence as possible. Encourage them to participate in daily activities and decision-making. Encouraging independence is a vital aspect of caregiving for individuals with neurological conditions. Focus on quality of life. Ultimately, the goal is to enhance your loved one's quality of life. Be patient and flexible. Neurological conditions can be unpredictable, and caregiving can be challenging. Adapting to changing circumstances, neurological conditions can fluctuate, and new challenges may arise over time. Flexibility enables you to adapt your caregiving approach and strategies to address evolving needs. Reducing stress and tension, patience and flexibility help reduce stress for both the caregiver and the individual with the neurological condition. Maintaining a positive relationship. Patience fosters a positive and empathetic relationship between you and your loved one. It demonstrates your commitment to their well-being and reinforces trust. Thank you for joining us today on the Neurology channel as we explored these valuable tips for caregivers. Your dedication and compassion make a world of difference in the lives of those with neurological conditions. If you found this video helpful, please give it a thumbs up, subscribe to the Neurology channel for more informative content, and share your thoughts or additional tips in the comments below. We'd love to hear from you. Remember, caregiving is a journey of love and support. Together, we can make a positive impact on the lives of individuals with neurological conditions. Take care, and we'll see you in the next video.